Hi everyone, welcome to researchmd.com. We got another great topic today. Today we're going to teach you all about osteoarthritis. Very common. And then again, my name is Pramil. Cheriyath. I'm a program director in internal medicine residency program, transitional residency program, and I teach medical students and residents. I'm also director of research. So let's get into our subject. So osteoarthritis is the most common form of arthritis, and some people call it like DJD or degenerative joint disease, or people say wear and tear arthritis. Most common in the knees, hands, and hips area you can have. And the epidemiology affect 32.5 million US adults, billions and billions of dollars spent on treatment, loss of work days and risk factors, joint injury or overuse, age, gender, obesity. Please pay attention. Obesity is one of the most common cause. So if you an examination that which contribute most common, I would say like obesity. Okay, it can be genetic, race, medical conditions also can contribute. If you look at the pathogenesis, is going to really fast. Degradation of cartilage and remodeling of the bone due to active response of chondrocytes in the articular cartilage and inflammatory cells in the surrounding tissue. Then you got release of enzyme from these cells, which break down collagen and proteoglycan, and then it destroys the articular cartilage, okay? And then exposure of the underlying subchondral bone results in sclerosis. Then you can have reactive remodeling changes that lead to formation of osteophytes, the classic finding, osteophytes, and you got subchondral bone cysts. That's what you're going to see in the x-ray. Joint space is going to be progressive, lost over time, and what will you see in the x-ray? Joint space narrowing, okay? Remember, osteophyte formation, subchondral bone cysts, and you got joint space narrowing. So most common symptom patient, joint pain, stiffness of the joint. Remember, stiffness usually in osteoarthritis like less than 60 minutes. If it is greater than 60 minutes, then you have to think about other autoimmune causes of arthritis. Loss of flexibility, tenderness, inflammation, crepitus, that's what you have to look for. Crepitus sound, grating, crackling, clicking, popping sound. You can have bone spurs. And then other symptoms is like unusual, uncommon symptom, numbness and tingling and the weakness. They're very uncommon symptoms, okay? So you can stage-wise in osteoarthritis, there's like 4 stages. Stage 1, stage 2, stage 3. Stage 4, we look at stage 1, you got minor wear and tear in the joint, no pain. When you go to stage 2, more noticeable bone spurs will be seen. Affected area feels stiff after a sedentary period. Patient may need a brace. And then you got stage 3, which is moderate. Cartilage in the affected area begins to erode, joint become inflamed, causing discomfort during normal activities. When you come to the final stage, which is very severe, a lot of pain, cartilage is almost gone, leading to inflammatory response, overgrowth of bone spurs, and may cause severe pain. So diagnosis, again, is a clinical diagnosis. The tests you can kind of use to rule out other condition, or you can look at the x-ray of the affected joint. If there's a fluid, you can do arthrocentesis. Arthroscopy is a surgical procedure, and you can do lab tests to make sure to rule out some other causes. So classical, I mean, always, people, they get in chest x-ray. Let's look at the sensitivity and specificity. Sensitivity is kind of really low, 21 to 57%, but specificity is higher, 75 to 100%. So what are you looking for in the chest x-ray is important. Loss of joint space narrowing. You got osteophytes, subchondral cysts, and subchondral sclerosis. Remember, those very, very important. Those what are you looking for in the x-ray finding in osteoarthritis? What are they? Loss of joint space, osteophytes, subchondral cysts, and subchondral sclerosis. And then what is the treatment? Mainly, they initially always want to try like Tylenol, acetaminophen, tropical therapy, exercise, physical therapy. So if we have patients coming in, always try physical therapy first, and then you can, if it doesn't work, you can try non-steroidal anti-inflammatory. Just be very careful with NSAID. Because it can, I would kind of hold off on that. It can cause a lot of complications, bleeding, GI bleeding, and kidney failure. So stay away from a non-steroidal inflammatory drug that much. You can do tramadol, which is a low potency opioid, and Cymbalta, SSRI, also has a big role to play. So I would stick with, if I have to, acetaminophen, physical therapy, try tramadol, duloxetine, and then you can have carefully, like if the pain is like unbearable, you can have a carefully supervised opiate as the last minute. I would still stay away from it. So what I would recommend is mainly Tylenol, physical therapy, and then tramadol, or use Cymbalta or duloxetine. Okay. Thank you so much for watching. We'll be back with another presentation soon. I don't think